Welcome to the deep dive. We're going to be go through all the research that you sent over.
Yeah, think of us as your guides.
And today we're diving into, really data storytelling, COVID-19 vaccination.
Really interesting. You sent over data sets, vaccination rates, demographics. You even sent over some stuff about religious affiliations.
Yeah, that's a chance for us to look back. I mean, we all lived through this, but now with a data-driven lens.
Right, exactly. Not just looking at the numbers, but the human experience, societal trends.
Absolutely. Now, something you pointed out in the DIMA section of 3.pdf was the observation that men had a higher mortality rate from COVID-19.
Yeah, and what's interesting about this is it wasn't just like a little statistical blip, it was significant. So that kind of sparked more, investigation. And what they found is that there's this really complex interplay of factors that contributed to this.
So what were some of those contributing factors that researchers found?
Well, biologically, studies, suggest women often have a stronger immune response.
Okay.
And men tend to have higher rates of pre-existing conditions, things like heart disease. And that probably made them, much more vulnerable.
And your source also mentioned behavioral and societal factors.
Yeah.
I mean, maybe men were less likely to seek medical care early on, or maybe they held jobs that exposed them to more risk.
Precisely. And it's a really good reminder that data rarely offers these simple answers. It often leads to more questions. And you get a much deeper understanding of, how multifaceted issues can be.
Yeah, it's like peeling back layers of an onion, right?
Hmm.
So, one of your sources, included data from Google Health. This was on the progression of COVID-19 cases and deaths. This is from 2020 to 2022.
Yeah. Yeah. Looking at that data, especially, chronologically, it really brought back how fast this virus spread, the
Yeah.
scale of the pandemic, and, and the urgency surrounding, vaccination.
Absolutely. So that leads us right to vaccine distribution. One of the sources that you sent over had a pie chart, broke down vaccination rates by state. This is back in 2022.
Yeah, and what's really striking is when you look at the extremes, Mississippi, Louisiana, Alabama, Wyoming, they had the lowest vaccination rates, and then you had Rhode Island with the highest. What do you think explains such a disparity?
Well, the source suggests that access to healthcare, socioeconomic conditions, and even political leanings within those states probably played a role.
Yeah, it really highlights how public health isn't just about science and medicine. It's so deeply intertwined with social and political dynamics. It creates this very complex web of influences.
Right. And that same web of influences really comes into play when we look at the work of Michael Campoveri. He's one of the researchers whose work you sent to me.
Yeah, he was really interested in whether age, race, or gender influenced vaccine distribution. And he used data from 2024. Which is interesting because it's a few years into, the vaccination efforts.
Yeah, but he acknowledges in his comments and paste to text that his analysis was limited to a single date, and that that could have impacted his conclusions.
It's a really good point. When it comes to data storytelling, how might the story change if you actually expanded the time frame? A single snapshot can be informative, but it's only one piece of the puzzle.
Right. So let's dive into that snapshot. What did Michael find when he analyzed the 2024 data?
Well, one of the more interesting things was that adults aged 18 to 49, particularly females, had the highest cumulative total doses they received.
Interesting. And you might assume that, older adults being more vulnerable would have been first in line for vaccination.
Right. But it really challenges our assumptions, doesn't it? Risk perception. It's not always straightforward. Maybe younger adults were more motivated by protecting their families or maybe they wanted to get back to, all the things that they were doing before the pandemic, social activities and things.
Right. And, we can't forget the logistical side of things. I mean, teenagers and younger children, they rely on their parents or their guardians to kind of navigate the healthcare system. Maybe that created some barriers.
Absolutely. And, it underscores the need to consider, the whole ecosystem, right, surrounding a public health issue. It's not just individual choice.
His data also raises questions about this trend towards partial vaccination.
Mm.
Now, what does that mean? And how does it impact our understanding of, the overall picture?
That's That's a really crucial point, and Michael himself acknowledges that it needs further investigation, and he points out that the data he used doesn't actually distinguish between those who received one dose versus those who completed the full vaccination series.
So while the data shows a high number of total doses that were given out, it doesn't necessarily mean that those people have immunity, right?
Exactly, exactly. It's a great reminder that data storytelling requires very careful interpretation. We got to understand the limitations of the data. We can't draw conclusions that go beyond what the data tells us.
And I think this is where clear communication comes in, right? Part
Yeah.
of data storytelling is presenting that information in a way that is accurate, but also understandable.
Absolutely. You want to avoid jargon, technical language that might alienate those who aren't, data experts, but you still have to convey those nuances.
It's a tough balance,
Yeah.
but it's crucial, right? If you want those data insights to inform decision making and drive positive change.
Yeah, for sure. And speaking of positive change, Michael's work also touches on the issue of racial disparities when it comes to vaccine distribution.
Yeah, his findings really echo what we saw earlier, with that state-by-state breakdown. Certain groups, they just lag behind
Hmm.
in terms of those vaccination rates.
It raises some important questions about equity and access to healthcare. Are there systemic barriers that are actually preventing some communities from getting vaccinated?
Right, and how do historical factors, things like medical mistrust, play into these disparities? Data can help us identify these issues, but then we have to use that knowledge to actually find solutions.
Absolutely. Data storytelling isn't just about revealing what is, it's about inspiring action to create more just and equitable world.
So let's shift gears now. I want to talk about the role of religion. Michael Campoverde found some pretty interesting correlations between religious affiliation and vaccination rates.
You'll recall from his section in 3.pdf that he observed that Christians were actually less likely to get vaccinated compared to Catholics and Muslims. And he even included a pie chart, to kind of visually illustrate that difference.
Yeah, it's a compelling observation, but we have to remember correlation doesn't equal causation.
Right.
There could be tons of other factors.
For sure, for sure. It's possible that certain religious communities, maybe they had different levels of access to healthcare, or maybe they were exposed to varying levels of, misinformation about the vaccine itself.
Or maybe it's just cultural norms, within those communities, and that influenced how people made decisions.
Exactly. It really highlights the importance of approaching data with an open mind,
Yeah.
avoiding hasty judgments. And you want to consider multiple perspectives.
Data storytelling, it's about uncovering the complexities of human behavior, of societal trends. It's not about finding, easy answers. It's about embracing the nuance and asking thought-provoking questions.
Exactly. As we keep going through this data, I want you to keep that in mind. Think critically about the information that's being presented and come to your own conclusions,
Yeah.
based on the evidence.
Yeah. Because data literacy, I mean, it's really about empowering yourself to be an informed and engaged citizen, especially in a world that is, becoming more and more shaped by data.
Absolutely.
Now, let's take a second to kind of absorb all this information before we dive into the next part of our exploration of the data on COVID-19 vaccination. So, one thing that really stood out from Michael Campoverde's analysis was the difference in vaccination rates between like teenagers and younger children compared to other age groups.
It's fascinating, isn't it, how data can kind of challenge those assumptions we might have. Like I initially thought, oh, older adults, they're the most vulnerable, so they're going to have, the highest vaccination rates.
Right, right.
But when you look at what Michael found in his midterm presentation 8.pdf, it's a different picture. It's actually the younger adults, particularly 18 to 49-year-olds, that had the highest cumulative total doses.
It's interesting, yeah.
Yeah. And it really highlights how we got to consider things beyond just like medical risk, right? I mean, how
Yeah.
people perceive risk, it varies. And younger adults might have been, more motivated by like social things, like wanting to protect their families or getting back to, pre-pandemic life, all those
Right.
activities.
All those activities. Yeah, and we can't forget the logistics, right? I mean, teenagers, younger children, they often rely on their parents or guardians to navigate that whole healthcare system. Maybe that created some barriers.
Absolutely. It really underscores that, we can't just focus on the individual, choices. We need to consider the whole system surrounding the issue.
Right. Now, his data also raised questions about this trend towards partial vaccination that he talked about. What exactly does that mean, and how does that affect, our understanding of the whole vaccination situation?
Yeah, that's crucial. And Michael acknowledges that it needs more investigation. In his in pasted text, he points out that the data he was using didn't it didn't separate out people who received one dose versus people who got the full vaccination series.
So, okay, so even though the data shows a lot of doses given out, it doesn't actually tell us, how many people actually have that,
Yeah.
that immunity.
It's a good reminder that, data storytelling, it requires us to really think about what we're looking at. We got to understand, what the data doesn't tell us, and we got to be careful, about drawing conclusions that go too far.
Right. And that's where I think communication really becomes important, right?
Mm.
Part of data storytelling is figuring out how to present the information so it's accurate, but also easy to grasp.
Absolutely. We don't want to use a bunch of jargon and technical stuff that people won't understand. But at the same time, we have to get those nuances across.
Yeah, it's a tough balance.
Yes.
But it's so important if you want those insights in the data to actually be useful to make decisions and to drive change.
For sure. And speaking of change, Michael's work also looks at racial disparities, in vaccine distribution.
Yeah, his findings really line up with what we saw earlier,
Yeah.
in that state-by-state data. There's some groups that are consistently behind when it comes to vaccination rates.
It raises some really important questions about fairness and access to healthcare.
Hmm.
Are there barriers built into the system that are, keeping certain communities from getting vaccinated?
Right. And how do things that have happened in the past, medical mistrust and things like that, how does that play a role in these disparities? Data can help us to see the problem, but then it's on us to figure out what to do about it.
Absolutely. Data storytelling isn't just showing what is. It's about inspiring action. It's about creating a more just world.
Okay, so I want to shift gears a little bit. Let's talk about the role of religion. Michael Campoverde found some really interesting connections between religious affiliation and vaccination rates.
Yeah, you remember from his section in 3.pdf, he noticed that Christians were actually less likely to get vaccinated compared to Catholics and Muslims. He even put in a pie chart to really show that difference.
Yeah, it's interesting to see, but we got to remember, just because things happen together, doesn't mean one caused the other. There can be a bunch of other things going on.
Exactly. It's totally possible that, some religious communities, maybe they had different levels of access to healthcare, or maybe, they were getting different information, maybe some misinformation about the vaccine.
Or maybe it's just, the culture in those communities,
Yeah.
and that affected how people made their decisions.
That's right. And it really highlights how important it is to come at this data, with an open mind. Don't jump to conclusions too quickly, and think about, all the different sides of the issue.
Data storytelling.
Mm.
It's about showing the complexities of human behavior. It's not about finding, easy answers. It's about digging deeper.
Exactly, exactly. And as we go through the rest of this data, I want you to keep that in mind. Think about what you're seeing, and draw your own conclusions. Use the evidence.
Right. Because ultimately, understanding data, it's about empowering yourself. It's about being an informed citizen,
Yeah.
especially as, data becomes more and more important in our world. So let's take a quick break here to kind of process everything we've talked about so far, and then we'll come back and wrap up our look at the COVID-19 vaccination data. As we wrap up, our look at all this COVID-19 vaccination data, I'm really struck by how much we've learned. It's gone way beyond just the numbers.
Yeah, absolutely. We saw those trends emerge, those disparities, but more importantly, we started to see the human stories.
Mhm.
The stories that are part of all this data.
Right, right, and that's really what data storytelling is all about, isn't it? It's about connecting with with real people, with their experiences, even when you're looking at statistics, which can seem kind of cold and impersonal.
Absolutely. I mean, each data point, that's a person, right?
Right.
With their own circumstances, their motivations, their beliefs.
And we've talked about how, those individual experiences are often shaped by these larger forces in society, access to healthcare, cultural norms, even political views.
Yeah, yeah. And it's a good reminder that data, it doesn't exist in a vacuum. It's always part of a much bigger, more complex picture.
Yeah. Michael Campoverde's work, it really shows that he doesn't shy away from acknowledging the limitations of his analysis,
Mhm.
or the potential for bias in the data.
Right. In his midterm presentation, Nate.pdf, he specifically says, we need more research that takes a broader, historical perspective, because looking at just one point in time, it can only tell you so much.
And that's, I think, what makes his work so valuable is that, he's transparent, he's humble about it. He's not trying to push an agenda. He really wants to get to the truth of things.
Absolutely, and that's the difference, between just presenting data and really telling a story with it. Recognizing those complexities, the things we don't know for sure. That it's an ongoing process.
Right. It's about asking questions and challenging assumptions. Being open to the fact that what we know could change as we learn more.
Yeah, for sure, and maybe even more importantly, realizing that data itself, it's not neutral. It
Hmm.
reflects, the choices of the people who collected it, who analyzed it, who presented it.
Right. So as we finish up here, I want to leave our listeners with a challenge to be critical consumers of data.
Yeah,
Don't just take those statistics at face value.
yeah.
Think about where they came from, how they were put together, and be aware of potential bias.
Right. Look for context, look for nuance, and a willingness to acknowledge limitations.
Yeah, because understanding data, it's about empowering yourself. It's about being able to think for yourself and to come to your own conclusions based on the evidence.
Absolutely. It's about, recognizing the power of data, how it can shine a light on things, but also, how it can be misleading if we're not careful.
So as you go out there and encounter all this data, remember what we've talked about today.
Yeah.
Embrace the power of data storytelling.
Yeah.
To uncover those hidden truths, to challenge what we think we know, and to inspire positive change in the world.
Absolutely.
But always come at it with a critical mind. Think carefully, and really try to get to a deeper understanding.
Yeah. Great advice.
Thanks for joining us on this deep dive. We hope you found it insightful and that you have a new appreciation for the power of data storytelling.
Yeah. Thanks for listening. And until next time, keep exploring, keep asking those questions, and keep looking for the stories, the stories that are hidden in all the data around us.